CDC is now no longer recommending social distancing and quarantining to control the spread of COVID. It's also ending its recommendation for testing to stay policies in school. Instead, they say we should focus on reducing severe illness as a result of getting COVID. The agency says at this point, nearly the entire population has some level of immunity from vaccines, previous infections, or both, but it still recommends testing for people with symptoms and to stay home and wear a mask if you do indeed test positive. Joining us live right now to talk about this, UC Berkeley infectious disease expert Dr. Swartzberg. And Doctor, right now the state's 7-day positivity rate is at nearly 13%, and hospitalizations are still up. So do you think it's wise for the CDC to ease these safety guidelines?
Well, the CDC in small print says that if you're at high transmission, you need to be doing a lot of different things. Unfortunately, I think the takeaway message that people are going to get from the news, newspapers, et cetera, is going to be that everything's relaxed now. We're still at a high degree of transmission. And at the level we're having right now, we really have to maintain a great deal of caution.
And kids across the Bay Area are starting to go back to school, and the agency removed that recommendation that kids who have been exposed to COVID take regular tests in order to remain in the classroom. So what do you tell parents who may be a little bit nervous about that?
Well, I understand why parents may be a little bit nervous about that, but frankly, I think this aspect of the CDC's recommendation they got right. I think a lot of routine testing is not going to be of great value in terms of protecting our kids.
And with these new contagious variants, what should districts do if there is indeed an outbreak in a classroom? Could we see schools shut down, a return to remote learning, or are we finally beyond that?
No, we have no idea whether we're beyond it or not. And I think this is a key point. I would have liked to have seen the CDC emphasize more that we have to be willing to and ready to pivot back to more strict guidelines if there's a new variant that causes a lot of problems. And so I think the CDC's current recommendations for where we are with school starting are reasonable. But I'm very concerned about the fact that people are just going to have a lot of trouble putting the mask back on, more social distancing, et cetera.
Oh, I ask you one final question. What do you think happens when all the kids get back to school?
I think we'll see more cases. I don't think there's any question about that. Fortunately, a lot of kids are vaccinated. Unfortunately, but fortunately, a lot of kids have protection because they've been infected before. So I don't think we're going to see anything catastrophic right now. The numbers of cases, even though they're high, are coming down, and that's very encouraging. It's really what's around the corner that I worry about.
All right. Well, we're definitely not out of the woods just yet. So, Dr. Swartzberg, thank you very much. Always good information.
Thank you. Good evening.